everybody. Hope everybody's doing well. My name is Cristiane, and I'm an exercise therapist with Simply Health Solutions. And today I wanted to talk about the fall cycle and how to reduce your falls risk. Now, I've been working with seniors for quite a while, and falls prevention is a big, big, big topic. And the really important thing about it is just the fact that falls can have really, really terrible problems. It can cause, some bruising, some discomfort. It can cause some sort of long term injury. It can result in some sort of fracture or surgical interventions required. It can cause all sorts of things down the road. A lot of people who have a fall have a lot of um, they reduce their confidence to be able to move around. They're very nervous. If they're living at home, that might have implications. If they're living in assisted living, that has implications. If you're in long-term care, that has implications. So all of these things, falls become a very, very big issue to think about. Now, when it comes to falls, I always think about the fall cycle, where essentially what happens is somebody has a fall and then they develop this fear of falling. So it becomes a maybe this person no longer wants to leave the house, no longer wants to use a flight of stairs, no longer wants to do the activities that they used to really enjoy doing. The problem is that if now you're letting this fear of falling decrease your physical activity, that can cause a decrease in your strength. It really is that concept of use it or lose it. So if we're not using our strength, we end up losing. And that can be muscle, that can be strength in your bones, that can be your joints, and make sure your joints are staying nice and healthy. And the thing is, unfortunately, that decrease in strength in muscle and bone and balance and all this other things actually ends up increasing our risk of falling. So it seems very counterintuitive, but I've met many, many, many people in my career where exactly that happened, where they had a fall, became so scared, didn't want to do anything, but then their muscle mass starts to disappear. Their bones become weaker, their joints become more achy, their other medical issues start getting worse, and then their risk of falling becomes even worse. So we kind of have to learn to get our heads out of this headspace for our own sake long term. And then the problem is there are various different contributors to falls. So it's not this idea of one size fits all. I used to work as a falls prevention coordinator, and it wasn't as simple as, well, if person A had a fall, then we know it was because of this. We actually developed a whole panel of a bunch of different people to actually investigate each individual fall and each individual report and see what was going on. Was there something medically going on? Was there something environmentally, socially, psychologically? So it is not a one size fits all answer. Couple of contributors to falls can include things like biological or medical. So things like a recent change in medication, poor eyesight, different medical conditions. So whether you're developing Parkinson's or Alzheimer's, or if you've got diabetes and developing a little bit of neuropathy in your feet, all of these things can kind of contribute to your ability to maintain your balance. And also different medications. I had one client a long time ago who, out of the blue, started having a lot of falls, and we had no idea why until we talked to her nurse practitioner, who had mentioned that there was a recent change in her medication, and one of those side effects was an increase in dizziness. So after making modifications with those medications with the nurse practitioner, suddenly her falls weren't an issue anymore. So it really is a good thing to just kind of talk that over with your doctor. Then there's behavioral. So things like lack of exercise. If we're not exercising, if we're not moving out and about, we are going to have an increase in falls because we're just not using our muscles. We're not practicing our balancing. Alcohol consumption can definitely increase your falls risk, but also things like risk taking. And that's not just things like jumping out of an airplane or bungee jumping. But one thing I see really often actually are people who don't have the best mobility and they're jaywalking. So they're jaywalking on a busy, busy road. And, you could end up falling because sometimes those roads are uneven. And that puts you in a very, very dangerous situation because you really don't want to be having a fall on a busy road. Even on a small road, you definitely don't want to be having a fall because the car might not see you if you're on the floor. So, again, all these things, we really got to be careful that we are not putting our lives at risk. Couple of things, environmental. So things like poor lighting in your home. Um, I know I've kind of in my own home, I've worked on making sure that there is kind of decent lighting, especially at night. I really like those little automatic lights that come on. Let's say when you're going to like the bathroom, or if you're going into a room that maybe there's a light switch a few steps down. So sometimes having those automatic lights can become very, very handy. You're having improper footwear, that becomes a big issue. Or if you've got small pets. I used to have a small little dog that really liked to hang around my mom's feet. But that often contributed to potential falls because sometimes she would forget that the dog was by her feet. So, it became this tripping hazard. And I know for a lot of people that is something common with their pets, is their pets like to stay near you. So it is going to be something you have to be mindful of. And then we have socioeconomic factors. So some of those things are not even things even within our control. Things like improper assistive devices. I know tons and tons of clients who have maybe inherited or were given a walker or a wheelchair or a cane from another friend. Maybe they had somebody pass away and then they started using that person's assistive device, but a lot of times, if those things aren't measured properly, then it can cause other problems down the road. Or sometimes, if you're using one that maybe isn't the best fit for you. So maybe you're using a walker when you should be using a cane. Maybe vice versa. Maybe you're using a cane instead of a walker. Maybe the height hasn't been adjusted. I know sometimes my clients will buy, let's say, a walker at like Costco or like a home health department store, and again it wasn't measured properly, it wasn't made sure that that client would use it properly, so that can become an issue, and a lot of times that happens due to financial limitations. It can become very expensive, or sometimes the person physically cannot get themselves to an appointment, so that becomes an issue as well. Maybe the person has improper care or doesn't have very good access to proper care, home health. Maybe they don't have somebody who's able to come and help them with things. Um, whether it's grocery shopping or taking a shower or doing their laundry, housekeeping. There's all these different things that if we don't have access or we don't have the financial means to get help, it becomes very difficult for a lot of seniors. There are unsafe streets, not necessarily in terms of crime, but even just, is it properly maintained? So, is it regularly cleared for snow? Are there any cracks, major cracks in the road? Are things being, paved properly? All these different things are important to consider, and that'll depend on your neighborhood. So, certain neighborhoods, higher income neighborhoods, are probably going to be better well kept, better maintained. Lower income areas might not be as well kept. And then there's even just poor nutrition. So for a lot of seniors, proper eating is a very, very big issue. A, because of the cost of buying proper food, but also I also consider the fact that a lot of seniors can't get to grocery stores. They have a lot of difficulty maybe getting to the grocery store, even if they can get to the grocery store. It's a matter of how are they going to bring those groceries home? How are they going to unload them? Um, even simple things like, are they in a building that has an elevator? Because certain buildings don't have one. Older ones. Um, I once had a client lived on the third floor without an elevator in the building. So all these things become a very, very big concern. Um, or another thing that often comes up is a lot of clients, they don't have the confidence to maybe even make themselves a meal because they're nervous um, about maintaining their balance, or maybe they've got health issues, maybe they're going through cancer or different treatments and all these different things, so they're not able to make meals for themselves. So there's all these different things that we need to consider when we are thinking about falls prevention. Now, the solution, similar to the problem, are going to be multi factorial, right? So, this idea of there are various different falls prevention strategies that we should be considering when thinking about how do we improve our lives? How can we make things better? Now, the first thing I always like to do, especially if falls have kind of suddenly become a thing. So, maybe you had really great balance this whole time. All of a sudden, you're falling, 2, 3 times a day. I really would recommend talk to your doctor. Um, yeah, check your medications. See if there are maybe side effects in there, such as dizziness, slower reaction time, lower heart rate. I also recommend talk to your pharmacist about that same thing. Your pharmacist might be a really, really good resource, especially if you're seeing multiple different specialists. So each specialist might be giving you different medications. The pharmacist can kind of help you figure out if there are drug interactions between them and can help you understand the different side effects that are going on. Also, ask about the effects of maybe any specific condition you've currently been diagnosed with. So, if it's Parkinson's, osteoporosis, MS, fibromyalgia, even things like diabetes, right? All of these things, maybe talk to your doctor about or your specialist about in terms of your falls risk. And what are some things that you should be aware of, and maybe some strategies to reduce your risk. The other thing that's always good to double check is checking in on how's your vision. You'd be surprised how much we use our vision in balance. So even just I have clients where they're able to maintain their balance as long as their eyes are open. The second they close their eyes, their balance gets a little bit wonky. Check your hearing. I always think of that is really important, especially if you're, let's say, on a road and maybe if somebody's hurtling towards you on a bicycle and they're ringing their bell, if you couldn't hear them, you might be at risk of a fall because of that bicycle. And then things like your heart. So making sure is your heart doing okay? Because if our heart isn't working properly, maybe our blood pressure is is not good. That can lead to dizziness. I know my mom, just genetically, she is very low blood pressure, so she sometimes gets a little bit dizzy if she hasn't eaten or if her blood levels get really low. So it's just kind of making sure she's staying hydrated, making sure she is kind of, in her case, ironically, is making sure she is taking in enough salt because she's got low blood pressure. Although most people, it's kind of the opposite. Most people, we eat way too much salt in our diets. Most people, the recommendation is to lower our salt, but there is going to be the odd individual, like my mom, who actually has to increase their salt levels because of low blood pressure. Then it's thinking about removing home hazards. So thinking about is are there loose rugs or wiring in the home? Is there poor lighting? If there's been a liquid spill, do you have kind of something that you can put down just to make sure that you remember that there was a liquid spill? Because especially even things like water, if we wipe it down, it's still going to be a little bit wet for at least a little bit. And sometimes we have this habit of we leave the room, then we come back, we completely forget about the spill, and then we could end up having a fall, and that's not gonna be fun. And or I also think about the times where I've spilt oil on the ground, so it's making sure that, like, I've not only wiped it down, but I've kind of, used soap to try to remove that oil, and again, just reminding myself that that spill has happened, so that I don't end up falling, on that spill at a later date or a later time. And then just things like making sure that your hallways and your staircases are staying relatively clear. I know sometimes people have a tendency to store certain items near, let's say, like the bottom or the top of a staircase. But again, if we're not paying attention to it, we might end up tripping on that. And the last thing you want to do is trip down a flight of stairs. I did that as a kid. Trust me, I would not recommend. And then we have just making sure you're eating well. As I mentioned, there are going to be socioeconomic factors that we have to consider. So for a lot of people, might not have access to the greatest amounts of food. At one point, I worked in rural Ontario. Um, and it was actually very limited as to what we had access to. And then even though I considered where I lived rural, I had clients who lived even more rurally than I was, and they had even less access. And if this person was like a single mom or had tons of kids or had a chronic pain condition, that is going to limit them even more. So again, you kind of have to modify depending on your current lifestyle, depending on what you currently have access to. But do be sure to get in enough water. A lot of us are actually surprisingly dehydrated, don't get in enough water. Getting in fruits and vegetables, if you're limited in your mobility, maybe looking into frozen. And if you're at least tech savvy enough, as I do have several senior clients who are very, very tech savvy. So maybe looking into um, ordering online, ordering your groceries to be delivered to your home. And then maybe if you want to save on delivery costs, maybe doing a combination of maybe some fresh fruits and vegetables, but also frozen so that you have enough that'll kind of last you a longer while. Protein, make sure you're getting in enough protein. This can be animal based, non animal based, vegan, vegetarian. There's tons of options out there. Um, but really just making sure you're getting enough protein because if your body isn't getting in enough protein, your muscle mass will start to decrease because your body will need that protein for other things. So we have to make sure we are eating enough. Also, make sure you are getting in enough calcium and vitamin D. So those two things kind of work together. But make sure you are getting enough calcium and vitamin D so that you are getting very strong bones as you go about your day to day life. Because again, this is one of those things where we don't notice we're having low bone density until we fall and we hurt ourselves. And so we really don't want that to be the moment we find out we have low bone density. So again, maybe this is a thing you talk to your doctor about, checking your bone density, seeing if you're at risk for osteoporosis or osteopenia, and maybe just seeing are there things that can be done. And then just be sure to limit your salt and your sugar. Unfortunately, especially for those of us living in kind of North American society, there's a lot of salt and a lot of sugar in a lot of the things we buy from the grocery store. So you do really want to keep an eye on that. Using an assistive device. So, an assistive device can help to improve balance, increase independence. This can be a cane, a walker, wheelchair if necessary, power wheelchair. There are so many different types of assistive devices out there. So definitely, if you're feeling like you're at a falls risk, this might be something worth looking into. And in terms of government funding, I know that this is specific to Ontario, but I wonder if there might be other funding options in different provinces, in different states, kind of wherever you are, seeing if there is funding available, especially if you are diagnosed with a specific disease. There might be, if you look at the society for your particular disorder, there might be some funding options there. But in Ontario, I know that there can be some, I believe it's called the assistive device program funding. So really maybe looking into that program if you're in Ontario, but I believe it does require a assessment from a occupational therapist that is registered with that program. So if you are thinking about seeing an occupational therapist for this specific reason, just be sure to ask them if they are registered with the ADP program. And then don't forget about proper footwear and whether or not you have foot issues. So the thing I always think about is one shoe is not best for all situations. So for example, you don't really want to be using rain boots in areas that have carpet because those might end up sticking to the carpet and you can actually have a fall. I know it's very challenging, especially for clients that I have that have a home where there's carpet in certain areas and maybe wood flooring in other areas and tile in other areas. So it can be kind of challenging to kind of work that through. But that is something that you do want to think about is making sure you do have proper footwear. Be mindful of your foot movements. So, are you noticing maybe your feet are getting a little bit weaker? Maybe if you have had any sort of foot injury, has it kind of changed how you walk? I know people who have had, let's say, an ankle. They've fractured their ankle or something, and their foot was in a boot for a little while. Then they got out of the boot, and what often happens is it had changed how your body moves, but once the boot is off, your body still moves that way. So, kind of maybe taking a look at that and making sure that you are walking properly, that you're not what we call shuffling, right? Keeping your feet, making sure you are kind of bringing your knees up, bringing your toes up. All these different things could be helpful to maybe start thinking about. And then see a professional if you are starting to lose feeling in your feet. This is especially important in those who are diabetic. Or I also think about people who maybe have had a stroke and lost some function in their feet. So maybe talking to somebody about how to improve your balance with kind of the loss of strength or mobility in that particular leg. So again, kind of talking to a professional can be very helpful. And then lastly, making sure you are getting active, making sure you are moving. Exercise can help with so many things. It can help improve your balance, strengthen your bones and your muscles, decrease your fear of falling. I always remember I had a client who was in her 90s. She had a fall. She hurt herself, not super bad, but she did hurt herself. Very nervous to go back home, very nervous to be, back in the area where she did have the fall, but she was so dedicated, and she really worked really hard, and eventually, she was actually able to get down to the ground and back up without even needing anything. So, technically, her balance actually got better after that fall, not worse, and she just became very motivated to make sure she is, exercising on a regular basis. It also helps prevent various different types of diseases, helps lower your risk of heart disease, cancer, stroke, diabetes, um, lung disease. There's arthritis. There's so many things out there that exercise can be really helpful. One of the reasons why I like it, it's almost as if you're doing a treatment for one thing, but it's helping treat so many other things. And it also helps improve our mental health. We often don't realize how much being inactive actually impacts things like anxiety, depression, and all of these different mental health issues. So, really trying to make sure we are getting active is going to be really helpful. It also helps reduce age related decline. So, you do want to keep an eye on that, making sure that even though our bodies do start losing a bit of muscle and a bit of bone density as we get older, if we exercise, you'd be surprised how much you can keep, and honestly, for certain people, you can actually end up improving way more than you did in the past. I've seen so many heartwarming videos online of seniors starting to be active in their 60s, their 70s, their 80s. And it was just so cool to watch that transition go from somebody who is very inactive to somebody who can probably outrun me and outlift me. Couple of areas maybe to focus on are going to be things like lower body strength, core strength, and balance training. But kind of if you are doing just a generalized exercise program, you'd be surprised it'll probably target most of those things already. Now, how do you start an exercise program? That's always one big question that a lot of people I work with have. And at the beginning, I really like just going back to the Canada's guidelines on physical activity because I really think it's a really great start. The Canada's exercise guidelines have really evolved over the years, and I really like how now they talk not just about the time you should be spending in exercise, but also the time you should be spending else throughout the day. So, yes, you want to be physically active for, let's say, um, 30 to 60 minutes a day, but making sure you're not sedentary the rest of the time and making sure you're getting enough sleep. So I really, really actually like the new guideline. And maybe as a start, depending on where you are physically, maybe starting with just getting 150 minutes of moderate to vigorous activity per week. And maybe just start there. You can really break that up. It does not have to be 30-minute bouts, 1 hour bouts. It can really be 10, like a 10-minute walk, 2, 3 times a day. Really, really depends on where you're starting off right now. And then just kind of slowly improving as you go on. And then you do wanna do some strength training at least twice a week. Again, you can kinda play around with it, do various different things. I really don't recommend doing the exact same exercise program, every single day. Um, Even programs that I have prescribed for clients, I often say, "Don't let this be the only thing you ever do," because no exercise plan is going to get at every single muscle you have, so you do wanna add some variety to that. And then some evidence suggests that higher intensity exercising improves the effects of being physically active. So, going at a more vigorous intensity is going to be generally better for you than a moderate intensity. Now, obviously, you have to take in your own medical history into account and your own physical abilities into account. But when I say moderate or vigorous, that does not imply going on a marathon run or going swimming for 3 hours. It really is dependent on how much you're physically able to do right now. So for some people, one block or one walk around a block would be considered vigorous activity. For other people, that will be seen as very, very light activity. So again, really depends on what your current abilities are. How to get started. First off, always make sure you're checking with your doctor before you're starting any sort of new exercise program because you want to make sure that you're medically cleared to do exercise. And if you are kind of new to this, or maybe you are going through a certain medical diagnosis, do make sure maybe talking to a certified exercise professional or a physio, or depending on your situation, maybe a physiatrist. And then just talking to somebody and working through kind of the beginnings of your exercise program. But first thing I like to do is just testing people. See what you currently can do. So think about movements that you're currently struggling with. That's usually my first question is, are you able to get up and down a flight of stairs? Are you able to get up and down from a chair by yourself? Are you able to walk for 10 minutes without getting breathless? All these different things, thinking about what you're currently able to do. The reason I like doing that is because maybe if you start exercising and in 6 weeks you have improved, but if you don't know what you were like at the beginning, a lot of times we don't realize we don't feel like we've actually improved. We feel like, oh, well, I just did what I've always been able to do these past 6 weeks. So it is kind of actually almost rewarding to kind of have a baseline or a starting point so that we know kind of where we've come from. If you want to get really kind of nerdy about it and you really want to look into very specific kind of tests, there are various different standardized tests out there that you can look into. Um, if you're thinking about your balance, one that we really use kind of in the rehab world is the Berg balance test. So if you ever wanted to look that up, you can look into that. Always make sure you have somebody else in the room when you're testing your balance or doing a balance program, just in case. I always think safety first. You always want to make sure somebody is around in case you lose your balance or if something happens. Then you just try. You try different things. So start with short exercises. Maybe you go up and down your flight of stairs once or twice or 3 times, depending on your abilities. Join a group class. Use online videos. Just recently, I found this really great online exercise video, and I've been doing that for the past week. And I thought it was great. And now I'm looking at the other videos that they have for the next couple of weeks. And so there's just so much great content out there that I think and a lot of it is free. So I really do recommend you look into it. Do make sure you take certain exercise videos with a grain of salt. and modify as necessary, which is my next point, which is adjust any exercise that you're currently doing. If you feel it's too easy, well, then maybe make it a little harder. If it feels too hard, make it a little easier, right? And just adjust based on your own abilities. So, for example, I help run a lung disease program, and that lung disease program, the ability of the people in that room vary drastically. So, we've got some people, very, very great physical ability, maybe have been in this program a couple of times, very physically active, they're able to keep up. And then we've got maybe new people or people with maybe more intense lung issues that might not be able to do all of the exercises exactly as demonstrated. But then we always talk about modifications. Modify however you see fit and whatever you feel comfortable doing. And then as you're getting better, start to increase your exercises, maybe add more repetitions, increase the weight you're using, increase the challenge. Um, just find different ways to just make it harder because you don't want to be, like I said, you don't want to be doing the exact same exercises over and over and over again at the exact same intensity because you won't keep getting the benefits, right? So it's nice when you kind of slowly increase that resistance or increase the challenge. If you do ever have like specific questions and you want to talk to somebody, feel free to contact me. We can always book a virtual appointment and kind of see if there's anything that maybe I can help you with in terms of your exercises. I worked with people with various different medical conditions from things like arthritis and back pain, tendonitis, bursitis, falls prevention, improving health and independence. So, really, if you just want a sounding board and getting some interesting ideas, feel free to contact me. And I always say we may not be able to completely eliminate every single fall because gravity exists. Even myself, I am very mindful about falls and I am mindful of when I'm going down a flight of stairs that I use the railing. I'm mindful of when there's ice on the ground. I'm mindful of maybe just different hazards around me in terms of falls. But even I know myself, I cannot completely eliminate my falls risk. And even my own clients, we can never completely eliminate our falls risk. But what we can do is work to decrease the impact that fall can have on our health. You'd be surprised because just having a fall doesn't necessarily have to mean that we're going to have a very serious injury, that we're going to require surgery, we're going to need a hip replacement. If you are healthy, if you're active, if you've got good bones, good muscles, you'd be surprised that a fall doesn't necessarily have to be something that causes just detrimental effects if we are staying healthy. If you do have any questions, feel free to email me, and maybe we can book an appointment. I do post a lot of my slides on my website at simplyhs.ca. I do record various different lectures on my YouTube channel, so feel free to check that out. And I hope you found this helpful. I really hope you find ways to go out and make it fun. That's the other thing I really, really try to drill into my clients is making sure you're having fun. It's not something you hate. It's not something you're doing because you feel it's good for you, but you have absolutely no interest in doing it. Um, find ways, whether it's online videos, Zumba, yoga, bike riding, swimming, as long as you're enjoying it and you're staying active, I think that is the more important part. So anyway, hope you found this helpful and I will see you later.